Hi, next speaker, Liz Nelson, one of the nurse practitioners in endocrinology and very prevalent on our diabetic consult service at St. Mary's Hospital. She's done a presentation on inpatient diabetes at numerous of our hospital medicine conferences. So please welcome Liz Nelson on diabetes.
Good morning, everybody. I'm so excited to be here. This is quite the crowd. So what I'm going to talk about is something I'm pretty passionate about. I work in both the hospital setting as well as outpatient. I initiated an employee community health clinic for patients with diabetes. So this is a big passion of mine. So this talk is going to focus primarily inpatient management since we're talking to hospitalists here. But if you have any outpatient questions or anything after the talk, I'm more than happy to speak with you one-on-one, or if you have a very specific case you'd like to discuss. So with that, we're just going to kind of get rolling, get into it. I'm pretty excited about this. There's a giant picture of me. All right, so I have no disclosures. And then you can see the objectives here. If I'm talking a little fast, it's because I want to get you guys to break too. I know that's important. We're going to talk about differences between type 1 and type 2 diabetics and how we manage them differently in the hospital. We're also going to talk about different programs utilized in special situations like our parenteral nutrition patients, our tube feed patients. We're going to talk about steroids. That's a great topic. A lot of things get brought up there. We're also going to touch a little on gastric surgeries because that's something that's becoming more prevalent, and I think it's good to have information about. And we're going to talk about insulin. It's everyone's fear here. So, how many of you, by show of hands, work with diabetic patients? So just a couple, all right. How many of you feel very comfortable managing these patients? You feel comfortable with ordering insulin, you kind of know what to do, all right. So hopefully maybe I'll give you a little pearls for those who feel pretty comfortable. For those who don't, I'm hoping that this is some great information to have. So I like to talk first about prevalence of diabetes. This is data from 2015, and so old data, but we know that this is growing. So 30.3 million people, or 9.4% of the US population, have diabetes, and we know that this just keeps growing. And if we look at the World Health Organization on a kind of worldwide level of diabetes, the number of people with diabetes has risen from 108 million people, and that was in 1980, to 422 million. So again, I think this is something that it's good to have kind of the basics down on what we need to do with these patients when we're seeing them in the hospital. All right, first question. Which age group has the largest percentage of diagnosed or undiagnosed diabetes?